What's up, guys? Dr. Dan here. We got Lexi in the office today. What's up? Lexi is new chiropractic patient here. This is her third treatment. She came in with some pretty significant right side neck pain, some hip imbalance, and some foot issues. Mm-hmm. One thing you had as a child, you had some braces, right? I also had braces. Orthodontics help mold the teeth and the jaw into correct alignment. But if any of you guys have had braces, especially, did you have to wear headwear at all?
No.
Okay, so I had a really bad underbite. I had to pull my front teeth back and they had to push my bottom jaw forward. And with the headgear, I had to put this like thing over my head with this big wire. Even though it aligns your teeth, it disorganizes your cervical spine, it disorganizes your jaw. So Lexi has a big bad CO, C1, C2, kind of like a bunch of muscle strain up here. Her neck was kind of kinked over. So we're going to do our conventional muscle work up to the right side of the neck, the right shoulder. We'll use Hypervolt on the shoulders as well, and then you guys will get to see her adjustments. Hopefully they move pretty smoothly today. I know her second appointment was really nice. So we're going to demo the back. So do you want to come back here before we even start? And one of the things we're going to kind of point out on Lexi, and this is just for viewer information, is the scapula, right? We're going to see how nice or okay this left scapula sits, but this right scapula, you guys can see how it's definitely a little more winged right here, right? If you on YouTube have been reading any of your, any of Dr. Google information, you may have seen pictures for upper cross syndrome where the shoulders start to roll forward due to pec irritation, spasm, tension, and muscular imbalance. So before we even start, let's sit forward for me. Put your hands behind you and palms down. And Lexi right here is working already on developing stronger lats, stronger serratus, anterior, posterior, rhomboid musculature. And we really want to work on this shoulder pack, we call it here. The shoulder pack is where we get the left elbow straight, the left shoulder blade back, and she's going to feel how this left triceps crushing already, and this left lat pulls back gradually. And then we're going to focus on the right elbow and the right shoulder blade packing backward. And Lexi's doing this perfectly. She's starting to create more strength in this back right corner versus the left side, the back left corner. This side probably feels a little bit easier for you, and the right side is like her tighter side. So on her initial appointment, guys, she came in, she said, "Ma'am, my neck has felt kind of crunchy and tight, right?
Tense, yeah.
Tense. And she's got a bunch of upper cervical, upper trapezius, levator scapula, supraspinatus, knotted up tissue over here on this right side shoulder, which obviously if you guys have been tuned in for a long time, so many patients have more right side than left side, but we still do occasionally find the left side on patients is actually their bad side. But for Lexi, she's got a little bit more on this upper right side. So we're going to start. I'm going to move her hair just a little bit. We're going to start with a little Hypervolt up around the shoulder blades. Lexi's going to sit right in this nice palm back and down position. Here in the office, probably one of the number one exercises we teach is the palms back and down exercise. The palms back and down exercise, it's a nice chest opener. It's a nice stretch for the brachial plexus, for some of the nerves, arteries, and muscles that run from the neck down into the arm. So if you're dealing with any kind of conditions like golfer's elbow or tennis elbow, medial or lateral epicondylitis, if you have any kind of funny bone irritation where you get like that ulnar neuropathy, or even carpal tunnel, sometimes numbness, tingling down into the hands, the fingers, and maybe even into the wrists and the forearms. If you go to sleep at night and you wake up and your arm is dead, your arm is asleep, your hand is asleep, that is where you have neurovascular, neurological, as well as arterial and venous constriction of blood flow or nerve electricity, and you can end up with numbness, tingling down into the hands. When I was a teenager and I was playing baseball, I commonly would wake up, my whole right arm would be numb from sleeping on it and causing nerve compression and, again, vascular compression. So we want to decompress. We don't want to stay compressed. We want to decompress the nerves that run from the occiput down to her C7 vertebrae. Those nerves run down into the arm, C8 nerve root, I should say. And we want to help stretch that stuff out. We want to reestablish good scapular biomechanics, good scapular movement, and nice and balanced muscles from the neck, the shoulder, and down into the mid-back. As we do these things, numbness, tingling, pain, irritation, muscle tension will all reduce. Lexi's going to develop stronger lats, stronger triceps, a stronger back chain, or a posterior chain as we call it. She's going to improve her posture. She's going to reduce tension and strain up in her neck. Gradually, as we work on the jaw and the upper cervical spine, she will also notice improvements in her chewing, her talking, and less irritation like up in the head region. Some patients who have TMJ issues, jaw issues, can get headaches. You can get pain in the jaw. You can get even like dull aching pain in the mouth. A number of patients come in, they think that they have an infected tooth or a cavity. They go to the dentist. Dentist says, "Hey, your teeth are clear," and the patient says, "Well, what's causing all this pain on the front of my head or the side of my face or the bottom of my jaw?" And many times it's irritation and compression of some of the stuff here that can radiate out into the front of the face, the side of the cheek. So as we do with all our patients, all of our people here in the clinic, we start with a nice little upper back massage with the hypervolt. The hypervolt is a form of vibration therapy, and it helps to resonate, it helps to vibrate and loosen up and stimulate some of the tight muscles up around the shoulder girdle to hopefully make our adjustments a little easier, also to help create some soft relaxation up here in the neck and the shoulders. Go ahead and lean your head over to the right for me. And guys, when she leans her head, you can see how this little stretch in this muscle fiber happens right here. Lexi's going to focus on a little bit of a shoulder back and a little bit of an elbow straight, and then a little bit more of a neck pull. And she's going to feel how she can herself start to decompress the cervical spine. Maybe it's a little head turn to the right, or maybe a little chin turn to the left over this way like this. Nice. You may feel more tension this way, or you may feel more tension if you turn your chin over to the right, like look down to that right. Yeah, there we go. So you see how that big band pops out right there? She's going to focus on two things. One, gravitational pull, a little bit of activity on the right side of the neck to help pull this out. And the second thing is going to be packing and straightening and really focusing on the tricep, the lat, to help offset the overcompensation, the tightness that the brain has created up in her shoulder musculature. Now let's lean head over to left side. The band pulls down into the top of the scapular complex. On the right side, she's got this super wicked tight band. You feel much tighter on this right side. You guys can also see how the scapula wings right here. So if we say, Lexi, pack this shoulder back, nice, fire this tricep. Right now, she's sending neurological activity, brain function, brain activity down to this right tricep, down to this right posterior shoulder. And she's going to help herself to get more muscle tension down here and ultimately less neck tension up top. Cool?
Yeah.
Can you feel how this side's a little tighter?
Oh, very tight.
Very tight. So these muscles, they pull way up into the occiput. The occiput's the base bone on the back of the skull. And you have this you have this super large amount of all of these jaw muscles and facial muscles and even neck and cervical spine and shoulder muscles that can get compressed. They get tight, they get irritated. As the muscles get tight, we can have increase in lymphatic congestion. You can have eustachian tube clogging, congestion, where you can get more risk for ear infections, really just like submandibular swelling, submandibular lymph node swelling, maybe some discomfort, some pain, ultimately bicipital tendinitis and elbow and wrist tension on this right side, right? And I'm going to try to move this so you guys can see. But just after 2 appointments already, we've had a nice reduction in the muscular and joint irritation high up here and the cervical spine. But she does have a little bit of C1. Feel that vertebrae right there. Mm-hmm. That's that C1. C1 vertebrae is a little bit irritated up here. And if you see me on camera, sometimes I kind of like zone out. I think with my fingers. A lot of times chiropractors will think with their hands. So my face might sometimes just kind of like zone out a little bit. But I'm thinking with my fingers, I'm feeling the palpation, the musculature. I'm feeling through palpation, the musculature and the joint irritation, inflammation. Generally, there's going to be a kind of like an epicenter, like a black hole. And the black hole is going to be the center of the muscle irritation, the center of the joint inflammation. You guys might have heard of like trigger points. And trigger points you can have just like the Milky Way galaxy, just like our galaxy, there's the center of it. And the center is where the most tenderness is at, and that's where we want to direct our palpation to. Look down for me. Good. Look up. Look down. Nice. Stay right there for me. Now we're going to roll this shoulder back. We're going to hit a little lower now. And our goal here is going to be to lean right, lean left, lean right, lean left, lean right, and left. And goal here is going to be to stretch or iron out some of the right side neck irritation, inflammation, muscle spasm, muscle tension, fibrous adhesions. All of those terms are things that are going on up in Lexi's right shoulder. Look down. Look down. Look up. Look down. Look up. Look down. Look up. Look down. So one of the things we commonly talk about with our patients is not only the manual therapy aspect, the treatment aspect, the hands-on muscle work, the hands-on adjustments, but also the correct, simple rehabilitative exercises that you can include throughout your day, throughout your week, at home. Look down. Look up. Look down. To help better your condition, to help promote better muscle strength, better muscle symmetry, better skeletal symmetry, and better balance. Feel that guy right there. Look straight down. Look up. She's got a big fibrous adhesion right in the supraspinatus right here. Look down. Look up. And look down. Nice work. Good. Back to center. Now on the left side, common to have some compensation up in the cervical spine, where she has no C1 vertebrae that pops out. She still has a little bit of muscle tension high up here under the jaw, under the angle of the mandible right here. But she actually has a little bit more, we're going to say right around C3, C4, and C5. Look down for me. And so again, guys, you can kind of like see this tight band that we run right over right here. And this is going to be something that over the next, 4, 6, 8, 10 weeks, we want to get totally calmed down so that she can stretch her neck nicely and have minimal tugging, pulling, or tension up into that cervical spine. Nice. Back to center. Good work. Okay, so other thing we check here, guys, is this little A to P, anterior to posterior pump of the left shoulder. The left shoulder moves nice. The right shoulder, you feel that click in there? Okay, so she's got a little click, a little grind, a little compression in her right shoulder, which is so common because we know her right scapula is already set a little bit better, but it does wing a little bit more on the right wing. So the right shoulder is a little more compressed. There's a little crunchy in there. And that sets you up for long-term risk of like rotator cuff tears, labral issues, first rib issues. She's got a little pec irritation right here for that guy right there. And so simplest fix that we want to do with Lexi, again, palms back and down, fingers flat, shoulders roll open. Nice. And if we say power up, Lexi, look how much easier that is after that neck work. And if we say coil, it's a left twist, it's a left elbow straight. And it's a hold for 20 to 30 seconds. And then it's a right coil and it's a right elbow straight. And we can just kind of feel how we want to work this side twice as much as the left side. So she might do 30 to 50 seconds on the right and then like 10 to 20 seconds on the left. This side she can pack much easier. She can lock out this elbow much easier. And then over to the right side. Nice. All right, let's go face down on the table for me.
On the beach.
Yes. So Lexi just moved back here from California, back to Pennsylvania. And she is getting acclimated in here as a chiropractic patient, but also over in the gym with some of our go-to training, some of our beat fitness training. She's working on improving her rotational movement patterns, her swinging, throwing, lifting, running patterns. Go ahead, push into my hand for me. Stop. Push. Stop. Push. And stop. Nice work. Push. And stop. Push. And stop. Push one more time. And stop. You guys can see just real quickly how we can improve the flexibility of the quad. Nice, relax for me. And now left foot up. And push. And stop. And push. And stop. And push. And stop. And push. And stop. But this left side, guys, gets a little easier right up. Good, relax for me. Gets a little easier up into the hip flexion. Not too much heel imbalance, not too much foot imbalance. So let's get right up into a little pelvic treatment. Very common to have imbalanced pelvis. In the pelvis, we have 3 bones. We have the sacrum, the left and the right ilium. And then right on the left side and the right side, you have your SI joints, your sacroiliac joints. And this is where she's got some, feel that stuff in there a little bit, girl? So right around this right SI joint, which is like S2, S1, S2, S3 right here, she's got some crunchy fibrotic tissue. Ideally, and ultimately, we want to take this tight tissue, we want to strengthen the feet. We want to get some more strength into the calves, the ankles, the arches of the feet. So Lexi's going to work on some bow set squats, some foot squeezes, and some nice power in her lower extremity to gradually balance out her pelvis. In some cases, when we have pelvic dysfunction, SI joint dysfunction, in guys and women, it doesn't matter, you can have radiation of pain around to the front of the pelvis. So sometimes like hip irritation, intestinal irritation. If your SI joint and low back dysfunction gets bad enough, it can also cause issues with digestion, pelvic floor musculature, so kind of like weak muscles in the pelvis. Very common, probably more common in women post-pregnancy that have, baby growing and lots of stretching of the muscles, lots of dysfunction in the pelvis. So you guys have seen some pregnant women on the channel that respond incredibly well to chiropractic care. And feels maybe a little sore around the hips. Yeah. Extremely sore. Very common to have gluteal tendonitis. Kind of like irritation of the glute med, the glute min muscles. Sacroiliitis, S-A-C-R-O, sacroiliitis means like inflammation, irritation of the sacrum. And then we can get like IT band issues, sometimes lateral leg pain down through here from all of these muscles that originate and stem from the sacrum down into the leg. Nice job. All right, so we are going to lower this a little bit, and let's put your arms right on the ground for me. Nice. So we're going to start with a nice thoracic adjustment. I'm going to push her hair out of the way. If you guys can notice on the table, we have a little bit of elevation on this right side versus left side. We know she's got a little more muscle tension up here. She's also got some rib imbalances throughout the mid-back. With chiropractic care, we're going to work on straightening everything out. With rotational movement training and some of the stuff we do in the gym, we're going to work on improving her left shoulder cut back and then her right shoulder cut back. And as she cuts back into the right side, she's going to get pretty sore through the mid-back here as we start to get these ribs to rotate posteriorly back to the right. Good, let's relax. Take deep inhale and exhale down. Whole way relax for me. Nice right there. Beautiful. Breath in. Exhale down. Whole way down. 1, 2. Breath in and exhale whole way down. 1, 2. Good job. Okay, so nice. Oh, there goes big sacrum on the left side. Now we need to do a little side posture on the right. So face over to the right side up. Sacrum adjusted, super nice, that left SI joint. All right, Lexi's gonna bend top leg, scooch towards me, kid. Perfect. Bottom leg straight. One more little scooch this way like this. Now arms cross, look up towards ceiling. Deep inhale and slow exhale, whole way right here. Right, nice, one more, good. Other side for me. On this side, we already got the left SI joint. Just with a little manual therapy or a little compression, we're gonna shoot for some of the low back vertebrae. Here and here, look up towards ceiling, breath in, exhale down, whole way, nice. Flat on your back for me. All right, good work, guys. So, a little bit of right SI joint dysfunction, left side low back adjusts just a little easier, and that's common to have kind of like an easier side and a tighter side. And then we work on a little bit, relax this left foot. A little bit of toe decompression, left foot adjusted easier than right foot. Good. Now left big toe if we can. And not today. Bend this left knee. Easy here. 3, 2, and 1. Right into here. Good. Back down here. Bend up here. Find this. Good. All right, kiddo. Can you touch feet together? All right, good work. Okay, so I'm gonna pull this out. Okay. Exercise Lexi's gonna work on. Bree, if you see the left arch is just a little better than the right arch. The left arch is just a little better form. You can also see how she's kind of like guided over this way a little bit. You can also see how the left knee is a little bit more externally rotated than the right knee, okay? So let's just relax the hands right here. Let's relax the shoulders right here. And let's focus on a little bit of heel pressure, a little bit of big toe pressure. And let's focus on just a gentle left knee open. And just hold right there. And you can feel how those muscles are kind of twitchy and shaky up in the left hip. Mm-hmm. And now let's focus a little bit on a right knee open. And this is going to be your weaker side. You may feel a little more shaky on the right side. Yeah. You may feel that this right knee doesn't twist as far open on the right side. So guys, this is our double bow set lay. The double bow set lay is where we touch the feet together. We focus gently on the left knee twisting open just a little bit for about 10 to 30 seconds. And then we focus on the right knee opening a little bit. And what we're doing here, we're stimulating the adductors, the quads, a little bit of the posterior chain with the hamstrings. We're developing a nice double bow set. Let's gently twist both knees open. Nice. And let's squeeze feet together. You guys can see a little bit of the fasciculations, a little bit of the twitching, a little bit of the unsteadiness in the legs. This is a beautiful pelvic floor exercise to help us kind of like compress through the pelvis. This is a nice exercise to focus on the adductors and working on your double bow set as well as your arches, your posterior tibialis, your calf muscles. She's got a nice fired up left calf, but this right calf needs a little work. We're gonna say twist that right knee open just 1 millimeter, nice, hold right there. We're gonna say straighten your left knee a little bit, lock it out, hold right there. You're gonna focus on right knee straighten back a little bit. You're gonna notice how the right side is a lot tougher than the left side. Mm-hmm. She's gonna lay in bed at night for 5, 10, 15, 20 minutes, however long she wants, or she can meditate flat on the floor with a little bit of movement medicine, a little bit of exercise, a little bit of pelvic floor therapy, a little bit of double bow set therapy to help us balance out the pelvis. That's gonna make her right side low back adjust easier. That's gonna help her right hip to get stronger. Relax here. And ultimately that's gonna help us to fire up our deep, deep, deep core muscles. In the GOTA system, we got the slant boards. She's going to do a whole bunch, thousands of correct squats. Relax this elbow. And we haven't had her elbows. There we go. A little bit, pushed it on the third visit. Sometimes it can take us a month, 2 months, maybe 6, 8, 10. Whoop, spit, or slipped. 6, 8, 10 adjustments to get the elbows to go. She's got some tight wrists, some tight forearms. Nice. But today we got both elbows, left side much easier. We also got left wrist. All right. Grand finale up in the cervical spine. We're going to hit mid-cervical. We said C3, C4 on the left. Relax here. Nice. And now CO, C1, C2. Nice job. All right, beautiful cervical spine adjustments. Lexi, spread your fingers nice and wide on your thighs. And just give me like a soft grip right there. And a soft shoulder pull. And now let's focus on the left hand gently pushing, the left shoulder gently pulling. Correct. The other thing that she's going to work on at home this week and really moving forward for the rest of her life is a little bit of left, there's no end to what we do, okay? It's always improvement. We always have improvement to make. We got left hand push, left shoulder pull. She can feel how the left side can activate really well, the left lat, the rhomboids, some of the mid-trap muscles. And now let's focus on right hand push and right shoulder pull. And you're going to notice how that side's shaking. How's it feel?
Better, a lot better.
Better than when we started, but how's it feel left side versus right side?
Oh, right side's a lot tougher.
Tougher. So if we say left hand press, left shoulder pull, this is a more grounded extremity. Now right hand push, right shoulder pull. And instantly she gets these little shakes in this right shoulder. So we need to perform some neurological activation of the lats, the triceps, the back chain, so that she can start to get back into that right corner, that right rotational pattern. Is that cool?
Yeah.
So if she's going to lay in bed at night, she's going to work a little bit on her double bow set foot presses. We're also going to work on a little bit of left lat, right lat for about 10 to 30 seconds of focus. Nice calm diaphragmatic breathing. We're not going to talk about that on this video, but on future videos we will. Sit up tall for me. Lastly, a little bit of shoulders. So we worked on feet, knees, hips, lumbar spine, thoracic spine, cervical spine, and elbows, wrists, fingers. And now we got to hit this right shoulder. So let's bend this guy up. Relax your elbow. Let me hold right here. And good. And now left side. Relax here. Nice job. Easy adjustment on the left side. A little tougher on the right. We started off with the palms back and down exercise to help her coil into the right side, coil into the left side, start to develop a little bit better of that rotational movement pattern. In the gym, we do a lot of the dowel rod, the underhand eights, right? A lot of the left pack, a lot of the right pack. We're going to work over in the facility, over in B Fitness, to get her into her bilateral symmetrical figure eight pattern movement, which is going to help her head to flow nice left and right and get that scapula nice and loosened up. Cool?
Yeah, thank you.
All right, guys. How you feeling?
Amazing.
Amazing. That's third adjustment here at the office. Cervical spine's adjusting well. As we work on the neck, the cervical spine, the mandible, some of that stuff is going to loosen up. We will start to do some TMJ treatment up into the pterygoids, the masseters, some of the jaw muscles, as well as temporalis muscles. We're not going to do that today, however. Okay?
Thank you.
Guys, we'll see you on future videos. Peace out.